Dr. Vijay Sinha, Senior Consultant in the Department of Nephrology and Kidney Transplant at JP Hospital, Noida. Today, I will discuss about the various reasons for kidney disease in our country. As we all know that there are 850 million people in the world who are suffering from kidney disease. In India, roughly around 100 million persons suffer from some form of kidney disease. Mostly these patients go on to develop end-stage kidney disease and require dialysis or kidney transplant. The major reasons for kidney failure in our country is diabetes, blood pressure, recurrent kidney stone disease, kidney infections, nephritis, over-the-counter medicines, and other various reasons like rheumatoid diseases and use of painkillers. So there is a large population in India who are exposed to the risk of chronic kidney disease. We need to follow certain principles in order to avoid the development of chronic kidney disease in our population. First is to treat the diabetes in the best possible way. We have to keep our sugar level. The target should be HbA1c of less than 7%. We have to treat our blood pressure by taking regular medicines so as to keep the systolic blood pressure of less than 130 and diastolic blood pressure of less than 90. We must avoid junk foods, live a healthy lifestyle, go for a regular exercise. We must take around 8 to 10 glasses of water in a day. We should avoid over-the-counter medicines. If we have any of the risk factors for developing chronic kidney disease, we must go for a regular checkup of our kidney health by doing a routine examination of urine and kidney function test at least once in a year. As we all know that roughly 5 to 10% of the admissions in hospitals are because of acute kidney injury, whereas roughly around 30% of the patients who are there in the ICU develop some kind of kidney problem while they are in the hospital. So there is a huge burden of kidney disease in a hospital setup also, and with the limited infrastructure in our country of dialysis and kidney transplant, the patients normally have got a poor outcome. So any patient who is landing up in a hospital, they must check for their kidney function test before receiving any kind of medicines so that they can protect their kidney health and they can go for an early dialysis wherever there is a requirement. As far as the best form of treatment for kidney patients is on what? It is the kidney transplant. Any person who is fit enough to go for kidney transplant must undergo a transplantation so as to lead a healthy lifestyle. Patients who are on dialysis must stick to the prescription written by the doctor as well as do their dialysis on a regular basis so as to avoid any potential complication. This World Kidney Day, the aim is to reach every patient of kidney problem anywhere in the world. The government has taken a lot of initiatives by starting multiple dialysis stations all over the country. So I request my patients and the general population to go for a kidney screening as well as those who are on dialysis to go for a regular dialysis. Those who want to go for a transplant must come to a nearby transplant center and get a kidney transplant done with a related donor. Thank you.